Hey guys, it's Lauren. Welcome back to my channel. Today I am having surgery to have a bone-anchored hearing aid implanted. But first, I want to take you along in my journey so far to get to this point. So growing up, like a lot of little children, I had a lot of ear infections. My mom said I was constantly at the doctor with a new ear infection. Hi. And so I had my first set of tubes when I was 2 years old, and then I had a second set of tubes when I was in the 4th grade, and then I had a third set of tubes when I was in 6th grade. After that, the doctor thought he saw a hole in my eardrum, so he then referred me to a specialist, which those of you who know about tubes, like tubes do create a hole in your eardrum. That's the point of them, but it's a hole that, at this point I didn't have any tubes anymore. The hole wasn't closing, it was still there. So he referred me to a specialist. What the specialist found was, it wasn't a hole, it was like a pocket where my eardrum almost appeared like it was like sucked back. So, okay, along the way, one of the doctors had found this stuff called cholesteatoma. I didn't really know what it was, and all growing up, and even to this day, I kind of just picture it like a bacteria that just kind of invaded my ear. So it's not a bacteria, it's not treated with antibiotics, but that's kind of just like what I pictured it as a little kid trying to understand what it was. So basically this stuff, cholesteatoma, came in and it was invading my inner ear, middle ear, I cannot recall at this point, but it was invading my ear. So I had 2 surgeries. I had one when I was in 7th grade and then 8th grade, and the surgeries were 4 hours long, but it was called a tympanomastoidectomy. Basically, they cut open behind my ear and they would clean out the cholesteatoma, and then in my case, it grew back, which is why I had to go in again. Essentially, this cholesteatoma had like destroyed my bones. So you have little bones in your ear, that's how you hear. So it kind of just like ate away at the bones. So my last surgery when I was a freshman in high school was where they went in through the same incision, so behind my ear, and they took out the bones and they put in prosthetic ones. So after that, I was supposed to have some hearing back, which I did. I had another hearing test. I don't recall now, but it did help my hearing. And we got to the point where the doctor's kind of like, this is what we can do. The next step from here is a hearing aid if you're interested. Being in high school, I was like, absolutely not. I am not getting a hearing aid. I've lived my whole life this way. I don't need to start hearing better at this point. So that's kind of how we left it. And, I had follow-ups for a little while, but there was a large chunk of my like adult life where I wasn't being seen by an ENT. I'm trying to think, probably like end of high school into all of college to even like a few years into being married, when I went to my primary and they looked in my ear so my bad ear is my left. They looked in the right ear and they could see a hole in that eardrum, which is how the doctor first thought the other one started, but it ended up not being the case. But that's, it was like a flashback. So I called up my doctor, who is really a pediatric doctor. Obviously at this point I'm married, have children, like I'm not pediatric age. And I said, what do I do now? So he gave me the name of 3 different doctors. He said, you want doctor number 1. He is the guy to go to, but if you cannot get him, then 2 and 3 are your next best. So I called number 1. He was taking new patients. Fortunately, he was in network for me, so I have been seeing Dr. Roberts out of Yukon Health for a while now. So I met up with Dr. Roberts. He obviously found the hole in my right eardrum. He looked at my left, and he says it looks as well as it would. He also said that he could see part of one of my prosthetic bones coming through my eardrum. So it has obviously shifted. It's not in the right spot anymore. which is why I felt like my hearing had gotten worse. So I was being monitored like every 6 months for a couple years by him. And then I had a hearing test done, and now you can hear different pitches, right? There's like low tones, high tones, normal tones, all that kind of stuff. So my audiologist said that normally they don't tell people like you have a 30% loss, because it really depends on like tones, and like, you know, you might hear perfectly fine with one but not the other. Where for mine, she said, because my hearing loss is across all tones and pitches, that she could say I had a 30% loss in my left ear when I took the hearing test 2 years ago at this point. So at home, I was noticing I couldn't hear people talking. I couldn't hear the TV. I really struggled with everything. You know, if I had headphones in, I'd only put the right headphone in because there's no point in having one on the left. So I decided it was time to talk about hearing aids. I'm at the point in my life, I don't really care anymore. It's not like a social thing. You know, I want to be able to hear. And it's very isolating to be in a large group when you have a hearing loss, because you're kind of just sitting there while people talk around you. And once in a while, someone will try and talk to you, but you don't hear them. And after you've already asked them what once or twice, you don't ask it again. So you kind of just nod or, you know, shake your head. But it's very, very isolating. Like it's really hard in group situations. So I have been finding it very difficult with my hearing. So I went ahead and started the paperwork and everything for a hearing aid. With the hearing aid, I had to have like a more recent hearing test. So I had one done, and my hearing loss had jumped to 60%. So in 2 years, I went from a 30% loss to 60. So it's kind of scary how I could lose so much more hearing in such a short period of time. I'm only 32, so I'm like, you know, how much longer is it, you know, am I gonna lose, you know, more hearing? So, you know, I'm only 32, so, you know, I feel like I'm gonna lose all my hearing in that year sooner than later. So it was kind of scary. So, but I started the hearing aid process. I had to pick out which type of hearing aid, the tip. I went with like a custom mold to my eardrum. Not eardrum. I had a custom mold of my ear canal made, which was the weirdest thing. She took like this little squishy foam, and it had a string on the end, and she shoved it all the way back. And then she filled my ear with this like a foam that dried, but as it dried, it expanded. So it really filled your ear canal. It was the strangest feeling. And then she had to like pull it out after it had like cured in my ear. So it was weird. But yeah, so the company would like make the little piece. So, and then once the hearing aid had come in, I'd be able to set up my visit to go in and, you know, put it on, try it out, make adjustments, get the app on my phone, all that kind of stuff. So I'm gonna just get my hearing aid right now, and I'll show you what it looks like. And let me backtrack a little bit. So when I first said to my doctor that I wanted to do something to help my hearing, he told me I had two options. He told me how I can either get a hearing aid, or they have this surgery procedure out there now that like puts like an implant in your ear, and it supposedly works really well. So yeah, so he gave me those two options. Now, when I had all those surgeries when I was little, I hated them. I had major anxiety about like the anesthesia part, like the putting the mask on. And then I just was like, I can never do surgery again. Nope, I won't do it. So I immediately shut down the surgery thing, and I was like, nope, I need to, I'm gonna do a hearing aid. So anyways, hearing aid, so I got the mold, did all that. Hearing aid comes in. So it's in this little box. The brand I went with is Oticon. So it came with a few things. It came with this little case right here. I don't know, it's kind of shiny. And basically, it's just like a little case like this that if I'm like out and about, I have to take it out, I'm swimming or something, it just puts it in. This is like a foam pillow type thing, but it just kind of protects the hearing aid. And then this is the charger. So picture Bluetooth headphones, this is the charger. So on the back, if I open it and close it, you'll see that there's 3 little dots that it's saying that the battery's dead. The case itself is not charged. So obviously a little charging port. So I only got 1 hearing aid. Otherwise there'd be 2 in here. So this is what the back of it looks like. And see if you can see that there. I can actually hear it turning on. But okay, so the piece that's on here now is not the one that was on here. Better, okay. So this right here, this is the custom molded, piece for my ear canal. It's still coming in blurry, but you can see. So I'm just holding onto this little piece here. That's what you hold onto it with. And then it goes, this piece comes off. So I'm not gonna take it apart, but this like little piece here, that blue that you can see goes into the blue on this. So I did a trial with it. I found that I was constantly like shoving it back in my ear. I felt like it kept falling out. So fortunately you had like a 4-week trial period, I think, with this piece. So what they did was they remade it and put a little fin on it. So now I got this piece. So I'm gonna try and show you. So that right there is like the fin. So essentially when it would go in, the fin, I don't know if you can see it, but the fin would like go up into this like alcove area and essentially keep it in. However, and then you take it out by this little string, or little whatever it is. So, but what I found from then is I was still shoving it in my ear. So I actually stopped using it because it was just too annoying. I just couldn't like get the hang of it. I couldn't deal with it. So at that point, my hearing was still kind of bad. Well, it was bad, but I decided I think I was gonna inquire more about surgery. This implant. So they're gonna implant something here and I'll hear through bone conduction. So the way that it works is that I will have surgery. They'll make an incision back here somewhere and they will put this little implant, screw it onto my skull, and then in like 4 to 5 weeks when I'm healed over, I will go back to the ENT and the audiologist where they will give me like the little magnet piece and they call it activating the implant. So I started talking to my doctor about this. I told the audiologist how I didn't like the hearing aid. It just kept coming out. Some noises were hard. It does work. Like you can definitely hear more, but you can hear more of everything. So for someone who hasn't heard all those sounds my entire life, it was interesting, but it was hard. And there were some points that like my kids were just driving me insane and I would just like take the hearing aid out because I just couldn't deal with it. But so when I met with her anyways, she ended up putting a new tip on the hearing aid because I was complaining about how I was constantly pushing it in. So she just put like a generic one. So every time I touch it, so I don't know if you can see, it's like this little itty bitty rubber bell shaped tip. So putting it on, you would just do this. It goes around the ear and then it just goes in. And it's actually turned on right now, so I sound really loud to myself. It did take a little while to get used to the sound, but I definitely did get used to it because I got to the point where when I would take it off at the end of the day, all of a sudden I felt very deaf, like I couldn't hear anything anymore, just until my ears adjusted. But so I wore this for a while, met with the surgeon, And I said, let's do it. Let's go in for surgery. You know, this hearing aid is not a long-term fix for me. Like I said, I'm young and I have a lot of years left, hopefully, knock on wood. But I want to be able to hear things. You know, even my kids know that mommy can't hear very well. So we set up surgery date, and it is today. It's July 11th. Right now it's the morning and I go in this afternoon, so I figured I'd get this video recorded before I went up there. But there's only really been one kind of like snafu, is that they almost had to reschedule it because they saw that because of my BMI, I couldn't have surgery at the surgery center. I had to be at the actual hospital. So they kind of like squeezed me in, which I'm so thankful for, because I had already had like everything figured out. Like, work is taken off, my kids are taken care of. I didn't want to have to figure that all out again. So anyways, yeah, so I'm gonna take you along in this journey. I'm getting anxious. They said I couldn't eat like 8 hours before, so I haven't eaten since last night, but they don't want us there until 2:45 p.m. and then my surgery is not till 4:15 p.m. They said it takes about an hour. I'm not sure, obviously, how it's gonna go. I'm praying that everything goes well and as it should. I'm pretty sure Mark is going to be bored out of his mind, but I'm going to bring my computer so maybe he can watch some shows. The implant that I'm getting, there are several different kinds. The generic name for it is a bone anchored hearing aid, because it is anchored into my bone. However, there are different versions. So mine is the OSIA, so it's OSIA. I don't even think I have the booklet here. I have it somewhere, but it is made, so the OSIA is made by Cochlea, like the Cochlear company. So it is considered like a cochlear implant, but it's for the bone anchored hearing aid, if that makes sense. So, you know, I've joined Facebook support groups just to learn more. There's definitely things that are going to be like on a learning curve. I saw people so one of the complaints is that this magnet can come off, and if you lose the top piece, it's like thousands of dollars to replace it. So a lot of people will use a little, it almost looks like fishing wire that is tied to this device, and they clip it in their hair or they clip it to their shirt. I've seen people even have it clipped to a little earring right here. So that's something I definitely want to look into before August 20th when I have it put on. So anyways, yeah, I'm gonna take you through pre-op, post-op. I'll take you through pre-op, post-op, recovery, all that kind of stuff. So if you are interested, or if you are also getting a Baha or an OSIA hearing aid implant, definitely keep watching and you'll learn some more and just see kind of my experience through it. It's 11:30. We don't leave here for another few hours. At this point, I'm not even allowed water anymore. So I'm trying to avoid outside because it's really hot and humid, and I know I'm gonna need water if I go outside. So I'm just hanging out. They told me to wear my comfy clothes, and I needed to shower to wash my hair this morning, so I did that. I have my comfiest shorts, matching sport bra set, and then this is a shirt I usually wear to bed because it's so big, so I'm just wearing that to the hospital. I don't know if they're gonna make me get dressed into a hospital gown and everything, which I haven't worn one of those since giving birth, so. And that was not even this last birth, because the last birth was in the car, so it was the birth before that, so 7 years now. But anyways, yeah, working on YouTube because I'm bored, and yeah, I want to swim, but because my hair is clean, I don't want chemicals to get in there, and who knows what would happen if I did that, so anyways. Good morning. It is the next recovery was pretty not fun yesterday. So they did take me in early. I don't remember now what Mark said. I actually sent him to Trader Joe's instead of waiting in the waiting room. But I think it took like an hour and a half. But he said it went perfect. I was super nauseous when I woke up. So that definitely kept me back a little bit. And then at one point, I felt something cold back here. So I felt the back of my neck and there was like bright red blood. So I was bleeding, obviously. So that was like a thing. The nurse who was working with me, he applied pressure, you know, and I mean, by the time I realized it was like all down my back, so he like cleaned everything up. I had to call the resident who was on call. Because at this point it was like after hours. I think it was like after 6 or 7, I don't know. He said that this pressure dressing had just slipped. So it was just putting pressure on the upper part of the incision, which was then forcing blood out the bottom. So he fixed the dressing. This is what any ear surgery dressing looks like. It's a Velcro on the head. I can't wait to take it off because it just feels so tight. But I'll show you. I have this. So my incision goes all the way down here. So yeah, right now I really want to try and just like brush my teeth, like brush my hair, just start to feel kind of human again, because I don't feel human right now. So my face feels greasy, just yeah, everything. So, and then I was even just now reading the report about intubation. They said they like tape my eyes shut, so I want to make sure there's no like sticky adhesive. So we'll see.
I never really know what's going on. Look at me sometimes like all you want to do.
They did say they might have to shave, which I guess they did. Cause my hair that just came out. There very well could be more hair. I won't know until I really take this off, but it's supposed to be like 24 hours, so I get to sport this all day. But I remember as a kid I would take it off like the next morning, so we'll see how today goes. This feels good. I'm just kind of like waking up my skin. Right now everyone else is sleeping. It's like 4 in the morning because I spent all day yesterday sleeping. So all my washcloths are upstairs. So this at least feels good. I have a waffle in the toaster. Figured it was pretty plain. The other thing I've noticed this time around, where I didn't notice it with my surgeries when I was younger, is I know they intubate you, and I never had a scratchy throat when I was younger, like never. In fact, I didn't even know they intubated you until like years later. But I have a scratchy throat, so it's a little better this morning. Last night I definitely could find myself like trying to clear my throat just to get rid of like the scratchiness. But anyways, I'm gonna grab my waffle, sit on the couch, and just recover. I'm a little interested to take off the pressure dressing and see what type of dressing is there. I do have to move my post-op. It was scheduled automatically for Friday, like a week from today, and he said it was it's too early, so I have to call and reschedule that today when they're open. But anyways, all right. I have not sat on my couch and watched TV like by myself in a very long time. If anything, my dog. If anything, I watch it on my phone. So I finally sniffing the bandage. So I finally decided I'm gonna sit down, put the TV on, not watch on my phone, and I can't figure out the volume. We have like a sound bar and we had to switch out remotes recently, so I don't know if something's not programmed right, but I guess I'm watching it on my phone until Mark wakes up and comes down to fix it. A little bit more of a decent hour, at least it's 6:30 now instead of 4:30. Hubs got up, he is taking the little one to daycare. I felt okay enough to help like put his lunch in the lunchbox. My mom packed it up last night, thankfully, and he fixed the TV. So I'm gonna sit here and just relax. I have tons of stuff I want to do, but as I tell my patients, the only time your body is healing is when it's at rest. So I need to make sure I don't do too much today. I'm hungry, but I'm not really sure yet like what my stomach wants. So I figured Eggo waffles are a good like bland option. And for some reason I really want a little bit of syrup. So I'm using my kid's plate to be able to dip it a little bit while I sit and watch my Hallmark movie. Little bit of an update. It's now 2 o'clock. My friend just left. I no longer have my head bandage on. A little bit of a warning right now. I am going to show my incision. So if you're someone that doesn't like anything medical, definitely skip ahead. But here is my incision and all of the area of hair that they shaved off. So you can see it's super, it like feels really tight right here. Right here is where the bump is the actual implant. So, but right now the whole thing just feels super swollen. So I'm gonna sit with some ice. Now that the bandage is not on, I can actually ice it, have some ibuprofen, maybe try and take a nap. Today is post-op day 2. I am not supposed to get my incision wet. And I'm not. Jackson knows he is absolutely not to splash me at all, but I just feel so gross, so I just had to get in some water. I did like take a bath this morning and did all that. My incision did start to bleed earlier, so it was a little nerve-wracking. Wasn't sure, you know, if it like dehisced or if it's just bleeding from doing too much, but I got some pretty solid sleep last night. I was asleep from like 7:30 p.m. until about 4:30 a.m. and then I've been up since then. I did come home. I went to mom's for breakfast, and I did come home and take a nap on the couch for like 2 hours. So feeling okay, but the incision has some blood just dried up on it, so I'm not going to worry about that right now. Today is post-op day 3. I was actually able to sleep in my bed with my own pillow last night, so I actually got really good sleep. Today I'm finally feeling like myself again. The queasy, nauseous feeling is finally gone, so now I can actually tell when I'm hungry versus like not. The past 2 days I really couldn't tell if my stomach was just upset or what was going on, so that has returned back to normal. The pain is definitely minimal at this point. I am still finding that if I'm up for too long of a period, my head does get very sore, like trying to hold it up. So I am having to take little breaks and just sit down and like rest my head. But overall, doing worlds better than post-op day 1 and 2. So hopefully tomorrow will just be another good day and we'll go from there. Yeah, I'm excited to hear back from the surgeon of when I can shower, because I really want to clean the area, shower my hair, all that kind of stuff. Today is Wednesday. I had surgery 2 weeks ago tomorrow. I'm finally getting my stitches out today. I am so excited. They've been such a pain in the butt, but yeah, I can't wait. So I've been wearing my hair down kind of like this just to kind of cover it up while I'm at work. First day I did wear my hair like in a ponytail and I had someone like wrap it, but that night my son opened the microwave door and it hit me right by my implant site, so it hurt so bad. And the thought of like wrapping my head the next day at work, I just couldn't do it. So I've been wearing my hair like this. I can't wait to see how it looks, and I cannot wait to get in the shower and take like a full body shower. Like, clean everything, scrub my hair, scrub my scalp. It's been so itchy because even when I have like washed it with shampoo, I'm not like taking the time to really just scrub my scalp because I need to be careful of that area. So I cannot wait until later. But I will update when we get up to the doctor. All right, just parked in the parking garage. I'm gonna head inside and get these stitches out. You guys, the stitches are out. I actually asked him if I could watch because he has like the, I don't even know what it's called, but like when they look in your ear, I can see it on the TV. So I asked him if I could watch. As a nurse, I take stitches out all the time, but these stitches were like all one, where the ones I'm used to are individually tied. So it was pretty cool seeing it. It did hurt a little bit, more so because my hair is growing back. So some of the areas he would tug and it was my hair, but otherwise it was fantastic. He said it looks a little red, but otherwise he's not worried about it. He says I can start being active again. So I'm hopefully going to start training for the race. That's in like 2 weeks. So I need to get on that. But I don't know if you can really see. I'm in the parking garage, but it does look good. So a little raw, but he said that we'll just kind of close over. I can shower tonight, wash my hair. I can't wait to use like my scalp like scrubber. Obviously not on that area, but on the top of my head. So anyways, I'm gonna head home, about an hour drive, and then we'll have some dinner with the kids. All right. Water's turned on, little one's in bed. I'm gonna go take my first full body shower since surgery. All right, guys, today is activation day. I'm so excited. It's been 6 weeks since my surgery. So I am heading off to Farmington. It's an hour drive from here, which is where my ENT is located. So yeah, I'm gonna drive and I will update when I get there. So it is 9:25. I just got to the parking garage, so I have 5 minutes to park. Right now I'm on level 2. I park on level 3 because it connects you to the skywalk. So that is where I'm headed right now. I'm very excited. Like, I feel that my hearing lately has just been atrocious. Every other time someone talks to me, I'm saying I can't hear you. So I think this is going to be a huge change for me.
At 29 and I find myself wondering what did happen to the last 10. I ran away with my life, fast forward, never turn back again. It's kind of funny that the more we pass time, the more we need to set them rewind. And 19 was the year I had to leave you, but now I'm seeing all the signs. Is this really happening? I can't believe it's true. I'm just as surprised as you. Is this really happening? I can't be too sure, but one day I'll be yours.
I'm back in the car. I just had it put on. It sounds very similar to my hearing aid, but not as much like feedback, I guess you'd call it. I don't know. I just had my first phone call. Mark called me and it went through it. So it's kind of weird that I'm hearing it through the side of my head. And then I was walking in the parking garage and there was a car coming, but I didn't hear it, or I couldn't see it yet. But it sounded like, to me, what I'm normally hear, like a truck sounding like. So, but really it was just a car. So it just kind of makes, you know, you can see how different the sounds are. But I am going to head home and I'll do a final update when I get home to end out this video. All right, so today is Thursday. I was activated on Tuesday. Just wanted to give like a final update. I know they say it takes a little bit to get used to the sounds, but because I was wearing a hearing aid before, I am pretty used to the sounds already. There are a few things that I'm noticing, like when I'm driving in a car, I get like a static sound. It doesn't happen when I'm parked in the car, but definitely when I'm driving. So I'm not sure if that's normal or if that's something I'm just hearing now. I'm not sure. So I'm going to, more time will tell if I get used to it or not. But today was actually my first day, like wearing my hair down and over it. And I didn't get any feedback from it. So that is awesome, because that was one of the things I kept reading online, was people getting like feedback when like their hair touched it. So right now it's totally covered by my hair. All you can really see is this little chain right here. But otherwise you really wouldn't even know, like just looking, you just see the earrings. So I love it. I actually just got back from dinner with a college friend of mine. There was only like 2 or 3 times that I had to ask her what she said, and it was a packed dining room, so that was pretty awesome being able to hear everything. The biggest thing I noticed is like I take it off at the end of the day, and it's like a wave of deafness. Like all of a sudden I'm just like, wow, I really can't hear anything. It makes you appreciate how much you can when you have the implant on. But anyways, this is my process of from childhood, what I went through, getting a hearing aid, all the way to getting my implant surgery and then being activated. So I'm so thankful I did decide to go this route. Hindsight, I would have just skipped over the hearing aid part and just gone right for this, but it doesn't matter. I'm here now. The battery, so we put it in on Tuesday in the afternoon, and it did beep that it was dying Thursday afternoon today. So I did have to change the battery for the first time. I am working on, so I found on Amazon, they sell like a pack of 120 batteries for like $70, like 67 or something, which isn't bad. I mean, that covers like 240 days, almost, more than half a year. But I found there's a company called Sun Medical, and you can put in your insurance information and your doctor and all that kind of stuff, and then you, the patient, get a script from your doctor, and then they will try and get it covered through your insurance. So I figured, why not? With having surgery, I have already met my like max out of pocket. So right now everything's being covered at 100%. So why not try and get some batteries covered? So we'll see if that goes through. I did sign up for like a class through Cochlear's website. It's like it said 45-minute like tutorial type thing with a person going over how to use like the implant and the mini mic, because that was the accessory I picked out, was the mini microphone. So I didn't even like open that package yet, because I'm just learning how to like care for this one first. But yeah, so that is everything I have for you. Definitely leave any questions or comments down below. I will definitely help in any way I know I can. Certainly won't give medical advice if I don't know what I'm talking about, but being medical, at least I do know a little bit. Plus living it, you learn things along the way. But if you guys enjoyed this video, be sure to give it a big thumbs up. And if you want to join the family, click that subscribe button as well. And I will see you guys next time. Bye.